All right, guys, let's talk about the CO2 laser. If you're in my chair, you're gonna hear me recommend this quite a bit. And I know I'm asking a lot from you when I'm recommending the CO2 laser, but I absolutely love it. And there's not much that can achieve what the CO2 laser does with one visit that any of my other lasers can do. So you're probably watching this video because I've told you, watch my video on CO2. So let's get the skinny on CO2. CO2 is a laser that helps use a light beam to vaporize the top layers of dead skin and wrinkles. And so that's often what we need for etched in lines. So when you come in asking for me to get rid of your 11s, get rid of your smoker's lines with Botox or filler alone, I'm gonna say you're gonna need something more aggressive. That's not gonna do it. Botox will relax a wrinkle, filler will fill in a wrinkle, but you're still left with the wrinkle. So what we need to do is totally eliminate the wrinkle. The only way we can eliminate the wrinkle is to vaporize it away. Sometimes we can do that with one treatment, but oftentimes we're gonna have to repeatedly vaporize that particular wrinkle over time. So many times when you have really etched in lines around the mouth, in between the brows, anywhere in the chin area, we'll often need to do this 2 or 3 times just for those specific wrinkles. But a full face CO2, I may ask you only to do once every 3 to 5 years. If we're seeing results after one treatment and we're seeing a new kind of skin, I may ask you to do it sooner than that 3 to 5 year mark. But it's because we're actually making a significant improvement in your overall skin texture and tone. What I don't want people doing is trying to chase their tails with skincare and the wrinkle's not going to go away, or injectables that are not going to completely eliminate this wrinkle altogether. So CO2 is a pretty aggressive treatment that requires about 2 hours of numbing time. So this laser is mostly for skin types that can burn. If you're not a burner, you've never got a sunburn in your life, this is a much more dangerous laser for you, so you will get other options of different lasers. But this is typically for someone, even if someone Hispanic like myself, but I can sunburn, then I can tolerate this laser. So think outside the box. It's a really beautiful laser. It can also take off little moles and take off little spots that might be growing. So it has a lot of utility in it. We'll often have it on in clinic and just zap little areas off for you while you're sitting in the chair if something's bugging you. Remember, you do want to numb for a good 2 hours for this procedure. It is quite painful. We offer you medications to help relieve that pain, relaxation medications and pain medications if you so wish, as well as the topical numbing. You do have to have a driver with you because we can't let you drive home if you've taken those medications. There is some downtime with this laser. I would say that you would want to plan on at least 7 to 10 days of downtime, and even past that, you may still continue to hold on to a little bit of redness. We make it mandatory that you put on exosomes after the treatment, so that will help significantly with your healing. We also have some CO2 masks that are like hyperbaric oxygen that I recommend for all my patients to use after the treatment to get blood flow and healing factors over to the skin. Your results are seen as soon as a month later. You might still have a little bit of redness, but you want your ultimate results will be seen at 6 months. This is a no-brainer laser if you can tolerate it. If you have deep lines, you want to rejuvenate the skin. For some people, it's a one and done, and it's something that I personally do every 3 to 5 years myself. I would say that it's been my secret to having great skin for all these years, and I hope you guys come try it, or at least have a chat with one of us about it. Remember, we want you to look great so you can feel great, so you can do great things. Bye, guys.